I'm Dr. Ridgely, Jessica Ridgely, DO. I am here tonight to discuss sexual health through the ages. Just to give you a little bit of background about myself, I am internally medicine trained as well as integrative medicine board certified, and I am board certified in neuromuscular and osteopathic manipulation. I work at Skyridge Primary Care with HCA Health One in Lone Tree, and I do have my email at the bottom if there's anybody who would like to contact me with questions after this webinar. Thank you for joining us tonight, and I'm excited to talk about this subject because I do feel that it is a subject that is somewhat taboo, and people don't talk enough about the issues that they're having that might come up from a medical perspective from sexual health. And so I wanted to discuss what is sexual health, what is involved in that, as well as a few areas going from when we're younger to when we're older, including sexually transmitted diseases, intimacy, how that plays into our sexual health, as well as diet and exercise, libido. Libido obviously plays a very big role into whether we are comfortable with our health life, our sexual life, and then also the different things that cause that, as well as things that can be helpful in regards to that. Please go ahead and let us know any questions that may come in regards to this topic, and we will try to answer them at the very end. All right, what is sexual health? So according to the WHO definition, and I'm going to just read these, the WHO definition is access to comprehensive and good quality information about sex and sexuality, knowledge about risk, face, and vulnerability to adverse consequences of unprotected sex, access to sexual health care, and living in an environment that affirms and promotes sexual health. And I love these definitions, but I actually added some from the American Sexual Health Association because I do feel that these are very good additions to the WHO definition. And that is understanding sexuality as a natural part of life, being able to experience sexual pleasure, satisfaction, and intimacy, and being able to communicate about sexual health with others and healthcare providers. That last one, I think, is extremely important because we just don't provide enough information to our patients. And although I feel that all health providers are more than willing to discuss the topic, that we depend on patients to bring it up when it is an issue. So I do want to say that it's very important to do that if you are having issues. But hopefully this webinar will help you as well. Hold on. There we go. Let's talk about the elephant in the room. I think it is really important to talk about sexually transmitted diseases and what are aspects that are affecting things today, as well as important aspects about what to do about them. So the number one thing that I do want to state is that currently sexually transmitted diseases are increasing the most in the 50 and older individuals. That would be baby boomers and Gen X. And it's very important to understand this because I feel that once we get to a point where women are into the menopause stage, it's like, well, we can't get pregnant anymore, so not a big deal. But it is a big deal because sexually transmitted diseases are not fun for anybody. And when it comes to sexually transmitted diseases, condoms, not diamonds, are a girl's and a boy's best friend. So not only would you want to use them in your teenage years, but as you may change relationships, either through divorce or through loss of a loved one, then it is also important to consider these situations. So one of the things a couple of different things that I wanted to state is that HPV and chlamydia are not always symptomatic in men. So that's very, very important because women can then get it, and it is very symptomatic in women. HSV-1 is cold sores. It is common in about 70% of people. One of the reasons I bring that one up is because I think that there's this whole idea of STIs and, oh, not me, but there are certain ones that can be transmitted that a lot of people do have. HSV-2 is around 20 to 30%, I think, at this point. and that's worldwide. HIV cannot be cured. We have a lot of medications that can manage it and improve the outcomes, but we do not have the ability to cure HIV. And I think that's super important. The other thing that I wanted to mention is that syphilis is on the rise. And although it is very treatable, the only way we can treat it is if you get checked. And if you are in a situation where there may have been a potential transfer of a sexually transmitted infection, I recommend going to your healthcare provider and getting it checked. I hate to break it to you, but cooties do exist. It is just when you grow up, they're called STDs. So reducing STIs, condoms are the most important. Vaccinating for hepatitis B and HPV is very important. Hepatitis B can be vaccinated for at any point in time. HPV is up till the age of 45. So I do recommend that for anybody who is under the age of 45. It's a great idea to get that done. Reducing your sexual partners obviously will reduce the incidence of sexually transmitted infections, and then regular testing if you are participating in riskier types of activities from that perspective. So what phase of life are you in? That's the most important thing to talk about. I'm not going to be talking about fetishes today, although a very interesting subject. I do not feel that it meets the criteria for this one. But what we are going to talk about is how to improve sex life that is currently any kind of situations you might be involved in. So if you're in the area where you're finding yourself and your mate, or you're sexually experimenting, make sure you ensure consent and refer back to the last three slides about the sexually transmitted infections. From here forward, we're going to talk about if you're in a relationship and you're wanting to find improved sexual intimacy, sexual joy, sexual life, then those are things we're going to be discussing at this point. So we're going to discuss medical concerns that may arise from that perspective. So intimacy. In relationship, intimacy is associated with higher level of sexual desire. That's very important. So if intimacy is a problem in the relationship, that is something that needs to be addressed first. It is also associated with improved health statistics, including increased immune response, less medical issues overall, and improved stress responses as well. When he starts kissing the neck before Netflix even loads. Yes, some of us may have been in this situation before. I thought this was a funny little meme, so hope you enjoyed. We're going to talk about intimacy. So these are the things that are probably the most important. I did get these from the Gottman Institute, which is probably the #1 researchers on relationships at this time. So let's talk about improving emotional connection. It's very important to talk about things that are other than your kids and your schedule. Important to talk about things you want to do, desires, whether it is sexual or whether it is something that you want to do like a vacation. It's important to make sure that you're discussing things that are joyful to you and your partner to improve emotional connection. It's helpful to know your partner's love language. A love language is something that has had more kind of playtime currently in when it comes to relationships. You can actually do tests that are online. All you have to look up is the 5 love languages. For example, my husband's love language is physical touch, mine is quality time. And so it's important to him that I give him hugs and touch him. And then it's important to me that we have date nights. So it's important to know that and to try to use your partner's love language to show them emotional connection. It's important to show appreciation. Appreciation is very, very important. I think that in relationships, we have a tendency to take our partner for granted because life gets in the way and we're busy and there's so much going on with our families. And, once our kids are older, sometimes we're in the habit and we just don't put out that effort. So, one of the best ways to increase emotional connection is to say that you appreciate something about them, even which is something that you typically wouldn't think much about. Also, work on being vulnerable. Brene Brown actually has a great book called The Power of Vulnerability, and it talks about how brave and courageous people have to be truly vulnerable and what true vulnerability is. It's important to show our vulnerable sides to our partners, as otherwise, it's really hard for us to have that connection. If you do have concerns about that, I would recommend The Power of Vulnerability. I have read it multiple times and I think it's an amazing book. It's even really great as an audible. Also, increasing physical touch, and that does not have to be sexual. It can be any kind of affection. So it kind of goes along with appreciation of just touch, holding hands, or shoulder to shoulder when you're sitting, or something like that, where you are physically touching. When you're able to do that is very helpful. Another one is making sex a priority. It is actually very important for vaginal health to have sex 1 time per week. It helps to maintain vaginal health, and that has been scientifically proven. And it has also been scientifically proven that having sex more frequently actually decreases heart attacks. So that's very interesting. And then I think one of the things that's really important is try something new or old. And what I mean by that is, if you and your partner have things that you used to do together that you absolutely loved when you were dating or in your earlier parts of the relationship, try to rekindle those things that you guys really enjoy together. Or maybe there's something you guys want to start out new and do, like social dancing or something that does a lot of physical touching and laughter. Try something new together that would be something that gives you time together. I think those are probably some of the more important things that help us to improve intimacy, because we cannot improve sexual health in a relationship without having intimacy. There are apps that can be helpful to improve that as well. And I would look for those if that's something that, if you're super busy and it is something that you guys can, instead of texting, having more of a guided, hey, what do you appreciate about your partner from this perspective? Some of those apps can be very helpful. The one that my husband and I use is called Paired, and it can be extremely helpful to find out things about your partner that maybe you didn't know and didn't even think to ask, because, well, you guys have been together for a while and it just, you wouldn't think to ask. So those are some things to think about when it comes to intimacy. Let's talk about the diet that's important for sexual health. This is a little different than some of my other ones because I'm focusing on very specific nutrients that can be very helpful. The number one that I wanted to talk, well, I want to talk about all of them, but foods high in zinc are important. Zinc is a hormone balancer. It blocks heavy metals and helps you to flush out heavy metals. It decreases inflammation from smoking. It also improves sexual desire, arousal, orgasm, and sexual satisfaction for women, as well as reducing pain during intercourse. All very important things when it comes to desiring to have sex. It is important to also understand that if you are supplementing, you do not want to do more than around 25 to 30 milligrams per day, because your diet will supply the rest of it. And if you're getting more than 50 milligrams in a single day, it will cause a decrease in other minerals that are super important to your diet. The ways that you can get the way you can get zinc naturally is through oysters, beef and pork, beans, and seeds and nuts, specifically pumpkin seeds. So zinc is an important one. The next one I wanted to talk about is omega-3s. I probably talk about omega-3s in almost every single lecture I have, because it has been found to be helpful in most aspects. The Things to think about for this is that it does improve blood flow to the genitals. It does support hormone production. It boosts sperm quality if you're thinking about fertility issues. It reduces inflammation and it also enhances cellular function, as omega-3s make up the cellular bilayer for almost every single cell in the body. So it's super important for multiple different reasons. The foods that you can find it in is fatty fish, walnuts, flax seeds are the main ones. Seeds and nuts are probably the biggest things that you can for the alpha lipoic acid. And then if you're looking at EPA and DHA, it's mainly your natural sources of animal products. For fish are definitely the highest. You can eat 2 4-ounce servings of fatty fish in a week and get the amount that you need in an entire week. If you're eating other things, grass-fed beef does have omega-3s, grain-fed beef does not. Pasture-raised chicken, eggs of pasture-raised chicken also have those. If you're having wild meats, they definitely have omega-3s like venison, elk, bison, those types of things have it as well, just in lesser amounts. A 4-ounce serving of one of those is around 600 milligrams of EPA and DHA. There was a recent study that came out that talked about DHA slightly raising LDL. It was not the biggest study. It actually had less than 50 people in it, so I don't think it's super valid. However, it did make a big impression because I have been hearing about it. And what I want to say about that is, although it did slightly raise LDL, it also helped to improve the LDL function. And LDL is actually the cholesterol that is used for hormone production and is also for brain health. So DHA is still extremely important when it comes to brain health and hormone production. So just to think about that if you do hear about that study. Also, we have high fruit intake. This one, we're talking more about like berries, dark grapes, cherries, and citrus fruits. It was actually found to improve circulation, to relax blood vessels, to improve erectile dysfunction. And yes, that was a study that was done that showed that the higher the fruit intake, the less erectile dysfunction people had or men had. And it also reduces risk of getting that, as well as sustaining sexual activity. The ones that are biggest are those dark berries and grapes and that kind of thing. But citrus fruits as well as watermelon is another one. The other one, which is really important just from a health perspective, but it can also be very helpful in regards to sexual health, is nitrate-rich foods. These eventually turn into nitric acid, which helps to, not nitric acid, nitric oxide, sorry, nitric oxide, which is essential for vascular health. It causes vasodilation, especially, well, including to the genitals, and it supports and sustains erectile function. Those are like beets, celery, spinach, arugula, radish. Another few is dark chocolate, garlic, and walnuts. So all of those are very helpful in general to the health, but they will improve blood flow to the genitals as well. Red wine is similar to the high fruit intake. It has the antioxidants that do help to improve the circulation and help with erectile dysfunction. And for women, it's been found to improve sexual desire and improve lubrication in the vaginal area for women. So red wine is good. No more than 1 6-ounce pour per day is recommended. I do know that the Surgeon General previously stated that any intake of alcohol has a higher increase of cancer risk. And although there is a ton of data to support that, and I do support that statement, I will say that there has not been any significant studies that have found that red wine increases cancer risk. All right, moving on to exercise. Exercise is interesting when it comes to sexual health, because we think, well, the more you exercise, the more you'll have the interest in it. And that's not exactly true. Moderate intensity exercise has had the highest score for improving the libido, as higher intensity exercise higher intensity exercise for longer periods of time can actually cause increased stress on the body, which could be a problem. However, that does not cause issues, as they have talked about in the past, with erectile dysfunction and that kind of thing. But when I'm talking about moderate intensity exercise, I'm talking about more along the lines of, it's not a problem of doing a high intensity exercise program as long as you're not doing hours of it a day. So an hour daily or something of that, and also allowing for rest and flexibility in regards to that would be more of a moderate intensity exercise program. For women, acute exercise has been shown to increase sexual desire, and chronic exercise has increased sexual satisfaction. All right, let's talk about causes of low libido. And in this, these topics are going to be the ones we're going to kind of end with to kind of help with different issues that come up from a sexual health perspective. It is important to understand that medications such as antidepressants, birth control, blood pressure medications, and chemotherapy will all affect your libido. Also, it is important to understand that recreational drugs such as alcohol, tobacco, and marijuana affect your libido and can cause erectile dysfunction, as well as other issues that come up with longer-term use. The things that we're going to focus on in the rest of this webinar is low testosterone, erectile dysfunction, pain during sex, and vaginal health. The low physical activity does affect the libido, but we already discussed that one. All right, protecting testosterone. This is one that I also used in my hormone webinar, and I think it bears repeating, as testosterone is important for both men and women, and nothing is more of a pet peeve to me as looking at labs for women and seeing that a level of 0 in testosterone is considered normal. That is absolutely not normal. Both men and women do need a certain amount of testosterone. For men, it's typically around 500 to 1,000, and for women, it's about 30 to 70. But a woman who has a lower level than 30 is going to experience these issues. And so all of these things that we're talking about here can be very helpful for women who are struggling as well with low libido. And getting your testosterone checked is a good idea. So one of my favorites is quercetin. It increases conversion to free testosterone, meaning that the testosterone is available in the bloodstream to be used. It protects from oxidative stress, and the amount that is recommended is 400 milligrams daily. Another one that I think is super interesting is called stinging nettle. Stinging nettle inhibits the conversion of testosterone to estrogen, which can significantly be a problem. It also inhibits the conversion of testosterone to dihydrotestosterone. Why that is an issue is because although it is something that is usable for men, it is also something that is not the active form of testosterone that would be the most helpful. So the other thing it does is it lowers sex hormone binding globulins. So there's a chemical that will bind testosterone, and if it's too high, it will keep you from having that free testosterone that the body can use. So stinging nettle does all three of those things. The dosage is about 450 to 1,200 milligrams per day. And it is important to note that it can interact with diuretics, blood pressure medications, and anticoagulants. So if you're in any of those types of medications, stinging nettle is not for you. One of my big heavy hitters that I learned when I was researching this webinar is ginseng. Ginseng is super cool. It is an adaptogen, so it actually helps with the adrenal function, which I think we all have a huge amount of stress in our lives for the most part in this day and age. So ginseng can be helpful for that. And because it is helpful for that and it helps to modulate cortisol, it can actually be helpful to improve testosterone. Ginseng is one of those botanicals that is well known in Chinese medicine and is considered to be wasted on the young and should be used over the age of 50. However, if you are having problems, I think it is definitely something worth trying. So ginseng increases free and total testosterone. It improves erectile dysfunction at around 900 milligrams per day. For postmenopause, it can help with improving sexual behaviors as well as improving orgasms. That for women is a much higher dose of about 1,000 milligrams 3 times daily. It has been found to be safe. It does increase catecholamines, which help to overall improve desire. And it decreases prolactin, which is something that our body produces, but can be overproduced and does create decrease in libido. The other thing is vitamin D. Vitamin D does increase testosterone, and you want an optimal lab value of activated vitamin D of 50 to 80. That is optimal. You don't want to go over 100, and you don't really want to be below 40. Last thing is magnesium and zinc. Those are minerals that we get through food. Sometimes they are a little bit low. I did discuss how you can overdo zinc supplementation. Magnesium, it's really difficult to overdo magnesium, and typically your body will tell you if you do, either through looser bowel movements or feeling a little bit fatigued or something like that. But most people tolerate 400 milligrams per day, which is typically the recommended dose, pretty well. And that's not an issue. So those are the things that will help you to protect your testosterone levels and improve overall libido from that. As I said, ginseng was the one that I found to be the most interesting in my research for this webinar, and I do think it's worth trying given its many benefits. All right, let's talk about erectile dysfunction. This is obviously a problem that comes up for many men, especially over the age of 50. One of the first things you have to do is you have to treat your low testosterone. I do think that there's a problem when we give medications without looking for a cause. Sometimes we don't see a cause, but at the same time, managing the low testosterone is the number one important thing that we have to do if we're going to manage erectile dysfunction. We do want to eat foods higher in nitric oxide boosters. So if there's a question, you can go back to the information about the foods after this and get more information about that if you don't remember what we talked about with that. Ginseng, 900 milligrams, which we just did talk about as far as helping with erectile dysfunction. L-arginine is probably my second favorite thing that I found. I have learned a lot about this when I was doing my integrative medicine fellowship, that L-arginine has been found to be very helpful. There is a lot of studies that have shown it to be very helpful. There's actually a product called Argin Max, which has been studied and found to be extremely helpful for increasing both testosterone and helping with erectile dysfunction. And the levels are for L-arginine are 1,500 to 5,000 milligrams daily, divided into 3 doses. Medication support, once we know that testosterone is normal, is perfectly reasonable. Sildenafil is Viagra, tadalafil is Cialis. I do believe there's other medications that are now on the market, probably very expensive, but sildenafil and tadalafil have proven the test of time. They actually increase nitric oxide to help bring blood flow to the genitals, and it is how they work. So something to note when we're talking about nitric oxide and using foods that increase that in the bloodstream can be very helpful. All right, let's go on to pain during sex. This is typically, I'm not to say that men don't have this, but typically it's a woman issue. And a lot of times it's something that comes up in postmenopause because of vaginal dryness or other issues that can come up. It sometimes is found in younger women because of endometriosis and fibroids. And there's also pelvic imbalances, which I have dealt with quite a bit with osteopathic manipulation. And then the other one is a decrease in vaginal size. The decrease in vaginal size typically has to do with either longer periods of time without sexual intercourse or dryness causing a change in the vaginal mucosa that does not allow for the expansion of the vaginal canal during sex, and it can be very painful. We will talk about vaginal dryness in the next slide, so we're going to hold on discussing that. The pelvic pain, if you do struggle with endometriosis and fibroids, it is very important to see your OB-GYN and figure out the best option from the perspective of that issue. If it is a muscular, a pelvic imbalance, then that one is something that can be helped by manipulation, either through osteopathic manipulation or a chiropractor, if they're really looking to balance the pelvic area, to balance the pelvic floor. One of the best therapies, I think, when it comes to pelvic imbalance is pelvic therapy. And that is certain physical therapists who specifically do pelvic therapy and can help from everything from helping pain during sex to constipation and many, many other issues in regards to that. It is a very good therapy, but it's important to know that it is a little bit invasive because many times they have to go through the vaginal canal to see what may be going on to discover how to balance that pelvic floor area. However, those can be very helpful. When we're talking about a decrease in vaginal size, there is a home plan that I read about, which I've had a handful of patients do and had a lot of success with. So the first part of it is you need to have a vaginal expander, and there are vaginal expander kits. It is also important to know that they need to be able to vibrate, because vibration is very helpful to bring in the blood flow. And so how you do it is you use a lubricant to massage the vaginal canal and ensure there's lubrication. You would use a vaginal expander that feels as if it is stretching, but it is not painful. It is very important that it is not painful. You turn on the vibration for about 5 minutes. Once it's done, it's done. This is not about getting pleasure, but if you do, that's great. However, you do it for about 5 minutes. What that does is it brings in blood flow and it starts to reestablish normal vaginal mucosa that should be able to expand. As that expander becomes a little bit loose, then you would use the next size up, and you would continue to do that until you are able to tolerate it with your partner in a way that is comfortable to you. So that is the home plan for having an issue with pain during sex due to vaginal size. All right, let's talk about vaginal dryness. So there's a lot of important things that can be done for vaginal dryness, and well over 50% of women just assume that in perimenopause and postmenopause that this is just something that they have to accept and that it is not something that they can do anything about. And it is simply not true. As healthcare providers, I do think we miss opportunities to ask about this to our women who are in peri and postmenopause. So some of the things that can be helpful, vaginal estradiol can be very helpful. You put it in twice a week into the vaginal canal. Vaginal estradiol has never been found at that level to increase breast cancer. So it is important to know that. And it does help to reestablish the normal vaginal mucosa that we were talking about with those vaginal expanders in that home plan. So that is something that can be very helpful if you are trying to do the home plan, but just in general, it can also be helpful. A non-hormonal option for vaginal lubrication and to improve vaginal dryness is called Reverie by Bonafide. I have had a few patients use this and it works really well. Some people feel like this is a little messy, but overall, I think that it's a very useful product if this is a problem that you're struggling with. L-arginine is about 1 gram twice daily. That is what would be needed to improve vaginal dryness for women. Remember, I did say 1 gram 3 times daily for other things, but for vaginal dryness, it can be used 1 gram twice daily, according to scientific studies. And then increasing the blood flow through the nitric oxide foods, which we did talk about in the slide about diet. So those are the ways that can be helpful in managing vaginal dryness. And please, if you are having an issue, definitely discuss with your doctor the issue so that something can be done about it. I just found a whip, a mask, and handcuffs in my mom's bedroom. I can't believe it. She's a superhero. Thank you so much for your time and attention about sexual health through the ages. At this time, I'm open to any questions that anybody has about this topic. So the first question is, will a typical blood test for testosterone levels? And yes, a serum blood test is the best way to get a testosterone level. And it to do. For women, you just need a total testosterone. For men, I do recommend getting a free and total testosterone. And that can be asked for through your provider. Mhm. Next question is, where does one find a vaginal extender, or what it is actually called is a vaginal expander? That is something that you can actually Google and find online. And I did Google this recently to see what would come up. I don't know how any brands, so you'd have to kind of look at reviews and things like that. But the one thing that I will say is it does need to have vibration, and that was a little bit harder to find, but they work much better if it does have a vibration quality to it. But honestly, you can just Google a vaginal expander kit. Okay, so those were all the questions that we had today. If there are any questions at all that come up after, please don't hesitate to let me know. Also, you can continue to find this on the Skyridge site for Facebook for a couple weeks. If you would like to go back and look at this, or if you have somebody you want to recommend it to, you can definitely do that. And then after that, hopefully we will be able to put it on YouTube. And if you Google my name, you should be able to find it. I do have a lot of other webinars. If this one interested you, I do have quite a few webinars that are on YouTube on many different subjects. And I welcome anybody who would like to see them. They are free. So everybody have a great night.